So what is cirrhosis of liver? So what are the causes of liver cirrhosis? Excess consumption of alcohol, obesity, that is grade 2 and 3 or morbid obesity, chronic infection with hepatitis B and C viruses, and autoimmune hepatitis, where the immunity attacks the liver parenchyma to cause chronic hepatitis and liver damage. These are the most common causes. As we have seen, alcohol, chronic viral hepatitis, B and C, autoimmune hepatitis, and obesity-related non-alcoholic steatohepatitis. There are other rare causes, and Wilson's disease is commonly seen in children. So when we see this image, there is fatty liver initially in obesity. The fat causes liver enlargement and pain in the right upper part of the stomach region, and gradually there is fibrosis of the liver substance of the parenchyma, and as the fibrosis increases more and more, it becomes cirrhosis. This is the point of no return of the end stage liver disease. Is cirrhosis reversible? The answer is yes or no. Yes. It is to some extent reversible in compensated stage, in early stages of cirrhosis. And no, it is not reversible in late stages or in a decompensated state. So, can cirrhosis exist without symptoms? Yes. Cirrhosis in compensated state do not have any symptoms. As you can see here, compensated cirrhosis stage 1, stage 2, there are no symptoms here. And death rate at 1 year it is 1%, and it is 3% in stage 2. On the contrary, when we see the decompensated, there are symptoms, and they have abdominal fullness, and the veins are dilated in the esophagus, and the death risk at 1 year is 20%. That is 1 in 5 die, and in stage 4, 1 in 2 die. It is nearly 50%. Now, how to diagnose the cirrhosis at early stages so that we can prevent the progression to later stages? So we can diagnose with a special machine called FibroScan. You can see here, this is a FibroScan. This is applied to the abdomen, and a wave is, shear wave is being generated, and that is being recorded in the FibroScan. So depending upon the FibroScan readings, we can label the degree of fibrosis. F refers to fibrosis. F1 is fibrosis 1, and 2, and 3, and 4. F4 is cirrhosis. This is point of no return or irreversible fibrosis. This is reversible to some extent, F0, F1, and F2. But F2 is significant fibrosis. These cutoff values, they vary from disease to disease. And sometimes when there is a discrepancy or mismatch between the clinical symptoms and the liver findings, then we'll go for the liver biopsy, where a piece of liver is taken and examined under microscope for the disease. How to diagnose decompensated cirrhosis? It is mainly clinical, like jaundice, encephalopathy, abdominal fullness, blood and vomitings. We can use machines like liver ultrasound or CT scan. We can use an endoscope to look for the varices. So take-home messages from this video are: the FibroScan helps in identifying the early stages of liver disease, that is fibrosis, F1, F2, F3. Proper treatment can delay progression of the fibrosis or reversible cirrhosis partly. Cirrhosis is an end-stage liver disease. It is not reversible. If it is decompensated, they may require liver transplant. They are at risk of liver cancer.